Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We have a lot of topics today, including some news about TRICARE, the military health insurance, and the Trump administration's attempts to withhold data from the American public. But before we get to that, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for this video. You'll find lots of references in there that are useful related to healthcare and healthcare advocacy for universal healthcare and reproductive healthcare. You'll also find all of the links to the studies and medical reports and news stories. Anything I talk about is hyperlinked in that newsletter. You can subscribe to free, get it delivered to your inbox almost every day. Anyway, let's get started. Court to Trump, put the data back. A federal judge yesterday ordered government agencies to restore public access to health-related web pages and data sets that they removed to comply with an executive order by Trump. U.S. District Judge John Bates in Washington agreed to issue a temporary restraining order requested by Doctors for America. That's an advocacy group. The judge instructed the government to restore access to several web pages and data sets that the group identified as missing from websites and to identify others that also were taken down without adequate notice or reasoned explanation. The judge heard that the doctors are not able to provide timely care to patients without access to the removed data, and so the Trump administration actions trickle down to everyday people and cause harm. That's what he found. Anyway, the scrub material included reports on HIV prevention, a CDC webpage for providing clinicians with guidance on reproductive health care, an FDA study on sex differences in clinical evaluation of medical products. Wow, it's astounding they would take this stuff down. Anyway, removing important information from the CDC and FDA websites is delaying patient care, hampering research, and hindering doctors' ability to communicate with patients, the plaintiff's attorneys argued in a court filing. There's a link to the MedPage Today's story about it. A reader of the Healthcare Advocacy newsletter, Kel, alerted me to a number of problems with TriWest and shared some of the difficulties members are having with the new management. TRICARE is a healthcare program that provides comprehensive medical coverage to eligible members of the United States Armed Forces. It includes active duty service members, their families, retirees, National Guard, reserve members, and certain former spouses. There are several types of TRICARE plans, including TRICARE Prime, TRICARE Select, TRICARE for Life, TRICARE for young adults. Eligibility for the plans depends on the individual and their sponsor. The program is managed by the Defense Health Agency, DHA. Now, some of these plans are like an HMO. Some of them are more like a network that you go to, like with a preferred provider. They vary. Anyway, on January 1st of this year, a new government contractor, TriWest, I mentioned them, took over the management of TRICARE in the 21 Western United States. Members have had to wait 3 or more hours to talk to customer service, only to be disconnected. TriWest has lost prior authorizations, and so patients are not getting treated. There are reports of members with serious health issues who have not been able to get prior authorizations or referrals for care. They wind up in the emergency room as the only way they have to see a doctor. Now, DHA says they're aware and they're addressing the issue, but obviously it's not fast enough. Amid continuing problems with the transition to a new Western regional contractor, TRICARE officials have temporarily suspended a rule requiring policyholders to get referrals to specialists approved, essentially allowing TRICARE West Prime beneficiaries to bypass that contractor. that still doesn't talk about waiting online for 3 hours. Anyway, TriWest that will be some help, but it doesn't help everybody who doesn't have that particular TRICARE plan. So they got to get in gear. Now, those in the military, let's be clear, because I spent my entire adult life supporting the United States government and the military. And those in the military, they honor us by choosing to enlist. They don't have to do that. They deserve health care that works. And here's a quick action that we can take to ask our representatives in Washington, D.C. to just look into it and get it fixed. P.S. This is another area that universal health care, if we had universal health care covered by a public insurance trust, it would fix all of this. Remember, those prior authorizations pretty much vanish with universal health care on the public insurance trust. I'm just saying. Here's the action. Tell your member of Congress and senators that TRICARE members in the 21 western states are having problems getting medical attention with the new contractor TriWest. Hours on the phone, lost prior authorizations. This is not how to treat people who honor us by choosing to be in the military. There's a link to their contact information for your senators and representatives. You can use a ResistBot script below if you want to call them, or my favorite way, just send an email. And the way you can send it fast is by, on your cell phone, send a text message to 50409, and the message is sign, S-I-G-N, space, POFCKW. Sign, POFCKW. Here's what you'll send them. I'm your constituent, and I just learned that the Defense Health Agency has a problem contractor, TriWest, for TRICARE, the health insurance for the military, retirees, and dependents in 21 western states. Members are waiting hours online to rectify problems, prior authorizations are not being executed or are lost, and many members wind up in the emergency room instead of a doctor's office. DHA says they're aware of the problems with TriWest and are taking steps to mitigate the problems, but members are still not getting the care they need. Please send a letter to the Defense Health Agency and tell them that they need to repair this as fast as possible. We owe the military health care they can depend on. Thank you. This next one I want to talk about Trump and food. No, it's not Big Macs. It's about Trump wasting food and money. You know, every time he breaks the law and tries to dismantle the government, it's because he's going to be saving money. Well, here's one for you. $500 million in food aid is at risk of spoilage, sitting in ports and ships and warehouses after funding for the U.S. Agency for International Development, or USAID, was paused by the Trump administration, according to a February 10th report from a government watchdog. The report from USAID's Inspector General, apparently didn't get fired, highlighted the risks of safeguarding and distribution of $8.2 billion in unspent humanitarian aid after the Trump administration ordered almost all the staff to be placed on leave and ordered a review of U.S. foreign assistance programs. The story comes from CBS. Here's an extra credit action, if you got an extra few seconds on your hand. Let your member of Congress and senators know that since Trump and Musk want to close USAID, $500 million in USAID purchased food is at risk of spoiling, sitting on the docks and in warehouses because they're illegally shutting down congressionally mandated programs. Of course, the contact information is in the YouTube description box, or, my favorite, send a ResistBot email. On your cell phone, text sign PFACVU. That's sign space PFACVU to 50409. And here's the message. I'm your constituent, and I want you to know that $500 million in food purchased by USAID is at risk of spoiling. It's on docks and in warehouses waiting to be shipped to the hungry overseas because Trump has illegally shut down USAID's congressionally mandated operations. I thought he was so concerned about waste. He is creating waste. Farmers rely on this program as well, as do so many others. I want you to get USAID restored. You were not elected to close the government, you were elected to manage the government. Let's talk about drug cost hell. Thank you to Judy for sending me this story from Axios. And of course, there's a link to the Axios story. It is a very long investigation. Now, look, I'll summarize as best as I can for you. Most drugs that come to market in the U.S. are funded by the National Institutes of Health. Sometimes charities help with the research and with the development as well. That's the model pretty much for every FDA-approved drug in the U.S. over the last decade. Yet manufacturers and middlemen are still able to squeeze every possible dollar they can from the drugs, often at public expense. Here's an example. The gene therapy Zolgensma, it's Zolgensma, hard to pronounce, helps children that have been born with a fatal disease, spinal muscular atrophy, SMA. It helps them grow up and run and play like normal. It is literally a lifesaver. If they don't have this, they absolutely die. Development of this life-saving gene therapy was overseen by the company AVEXIS, now a part of Novartis. Now, when Zolgensma, I guess that's the right way, hit the market, it was hailed as a miracle drug. Some babies treated with it grew up able to run and play. It helped reduce the U.S. death rate from SMA, long the leading genetic cause of infant mortality. It cut that death rate by 2/3. Now, taxpayers and private charities, one of the charities was Sophia's Cure, they subsidized much of the science that yielded Zolgensma, providing research grants and opening the door to federal tax credits and other benefits that helped speed its path to approval. Yet that support came with no conditions, financial or otherwise, for the for-profit companies that brought the drug over the finish line at the FDA, particularly when it came to pricing. So you're probably asking at this point, what was the price? Hold on, $2 million per dose. AVEXIS, top executives and the venture capital backers of that company made tens to hundreds of millions of dollars apiece on the sales and when they were purchased by Novartis. During development, AVEXIS went public. The IPO and subsequent stock sales raised hundreds of millions of dollars for them, but little of that money went toward additional trials on Zolgensma. The drug's needed trials were actually very small, often involving 24 patients or fewer. AveXis and later Novartis, get this, they spent $12 million up to the point of approval. That's incredibly small to prove that the therapy was safe and effective and this is all based on information obtained through Freedom of Information Act requests from studies and in SEC filings. So they made hundreds of millions of dollars and they spent $12 million. And they were given money by us and a charity to actually do the work. $2 million a dose. This was a case where they balanced the life of a child against as much money as they thought they could possibly demand. Drug companies have a particular formula for setting prices, and I'm going to share it with you all. Quantum para possit. That's in Latin. In English, we say all the traffic will bear. This, even though we the people and a private charity paid for the research. The healthcare system we have in place lets them get away with this. And they get away with it because they can. If we had universal healthcare negotiating every drug for all 350 million of us, they couldn't do this. All right, that's what I've got for you today. Down below, you can like, share, and subscribe. Send me email or comments here or requests for stories or at healthcareadvocacy1, all one word, @gmail.com. Have a good evening.